South County Executive P.J. Wendell. With me today is Sheriff Jim Quattrone, and to my left is Christine Schuyler, Public Health Director. As we usually do, our weekly recap begins with Saturday, May 23rd. There were 2 new cases of COVID-19, bringing the county's total to 72. At that time, we had 28 active cases, and last Saturday there were 2,227 tests returned to Chautauqua County as negative. On Sunday, there were 2 more new cases to announce. On Memorial Day, there was 1 new case to report. On Tuesday, there were 2 new cases. Wednesday, there were no new cases. Yesterday, we reported 4 new cases, bringing our total to 81. And today we have 1 new case to announce, and that's a male in his 50s. Currently, there are 19 active cases that continue to recover in Chautauqua County, 258 under quarantine or isolation orders by the Public Health Director and continue to be monitored. And there's 1 person diagnosed with COVID-19 that's hospitalized in Chautauqua County. This was as of 5/27/2020. To date, there have been 59 cases fully recovered from COVID-19, 82 total cases. We have had, unfortunately, 4 fatalities, and 2,726 tests returned to Chautauqua County as negative, so 499 tests returned negative in the last week. So, point of information. As we've heard from the governor's press conference today, that those regions initially entering phase 1 reopening are moved into phase 2 on time. In Chautauqua County, we continue to move through our phase 1 reopening and hopeful that Western New York will move into phase 2 early next week after evaluation of our metrics currently under phase 1. I continue to participate in the daily Western New York control rooms meetings with Lieutenant Governor and leaders from across Western New York, and have been able to get clarification on many industries or business sectors after individuals have reached out to my office. I also continue to be an advocate for additional restrictions to be lifted. For example, this week we proposed outdoor seating for restaurants before they begin inside seating that's scheduled under phase 3. As was announced today in the governor's press conference, this is something they are continually actively looking at as we move forward. I also continue to speak. I just got off the phone before this press conference with Cattaraugus and Allegheny counties. We continue to work weekly, discussing any issues we have and monitoring our metrics and our progress throughout the Western New York region. We've also begun to have our county government look at strategies and plans for reopening when able, as we have been giving the same advice to our businesses to reschedule in later phases as well. We did receive clarification yesterday that the governor is still under restriction of a 50% on-site staff for non-essential workers, with the ability to increase on-site staff as the work becomes more essential within one department or another. We did find out today that that extension was granted until June 26th, with a 50% reduction in our government entities. I've created my own team to work with department heads evaluating their operations, especially those within public direct contact. We've been getting a lot of questions about the number of county services, such as the DMV and the pistol permit, as well as real property tax offices, just to name a few, and when they will be reopening. We will plan and ensure all precautions taken necessary completely and make sure that they are done and completed so the county services can resume as soon as possible, adhering to the state guidelines. And lastly, I'd like to talk about business assistance and reminders. All businesses must complete their reopening plan and get the electronic affirmation, and it's signed to the state's forward.ny.gov as soon as they reopen under the appropriate phases. This includes businesses that remained open under varying restrictions and those who were deemed essential throughout and did not close. If you have any questions, please go to forward.ny.gov. Complete these steps necessary so you are ready to open as soon as we progress into future phases. The County Economic Development Agency, the CCIDA staff, remains ready to assist businesses with questions, assistance programs that may be available, and other resources to ensure that we all come out of this and move forward. They continually check with businesses who may be encountering difficulty for various reasons. Our outreach has been really going well throughout this entire activity, and we continue to see and seek guidance and help for those who need it. This was also done prior to the COVID-19 and will continue during and after the COVID-19 crisis. As we reported before, there was great news last Friday as Peachtree baking products returned to the Silver Creek area. But unfortunately this week we had heard of other businesses that will not be reopening. As I've said very early in the pandemic, we need to focus on the physical and fiscal health and safety of our residents and businesses. This principle continues to be my main focus. In Chautauqua County, with our various partners, we'll continue to work with and assist businesses in our community. I believe that in Chautauqua County, our recovery will be greater than our setback, and we can only achieve this by working together in what I've termed a unity of effort. So at this time, I will turn the microphone over to Christine Schuyler, the Public Health Director.
Thank you, County Executive Wendell. I thought I'd start today with explaining a few of the terms that we commonly use. When we are reporting out on how many new cases we have, that means those are the cases that have been reported to us in a day. So someone either has signs and symptoms of COVID-19 and they seek advice from their healthcare provider, a test is ordered, they go and get the test, or anymore, if someone just feels that they should be tested, they can still call their provider, or they can go to WellNow, Urgent Care Center, and get tested. That specimen is then sent to a lab, and there are a variety of labs that analyze these tests. So then it takes a time period for that lab to analyze the test. Every lab in this nation is required to report to the New York State Electronic Reporting System. So it doesn't matter that a lab could be in Pennsylvania or in Massachusetts or wherever. They have to report that a reportable disease, which COVID-19 is, into that system. So once that report hits the state electronic system, it's downloaded to the local health departments. So when I've had a lot of questions about a spike from Memorial Day weekend, and that gives you somewhat of an idea of how these things work. The incubation period for COVID-19 is 2 to 14 days. So if someone were exposed to someone, then it's going to take usually a few days or more for symptoms to arise, for them to call a healthcare provider to go through the testing process, and then for that lab to analyze it and get that report back to us. So that's why you don't see things immediately, and what we report out on a number of cases is the day that it's been reported to us, not necessarily the day that someone fell sick or the day that they were tested. Another thing that you may notice differently in our numbers that I really want to make sure everyone understands is the hospitalizations. Every day, hospitals are required to fill out what's called a HERD survey. That's something, it's an electronic system with the state health department. Every hospital in New York State goes on, and they have to say how many patients they have in their hospital that day. They also break it down now according to how many patients are diagnosed with COVID within their hospital. And they've always had to also report on the number of patients that are in ICU beds. So the state health department gets that information every day. As a local health department, we have access to that. Now it's a day late that we're getting it. So when we say how many hospitalizations there are, that means how many people are in a hospital in Chautauqua County with the diagnosis of COVID-19. It could be an admitting diagnosis. It could be someone came in for a procedure and happened to be tested and came back positive and were asymptomatic. Or it could be somebody from another county or another state who was hospitalized in a Chautauqua County hospital with a diagnosis of COVID-19. I just hope that kind of clarifies some of these terms a little bit for people. One thing that has been noted nationwide, that there seems to be a lot of other health concerns, preventative care, chronic health conditions that are going untreated during this time. Obviously, COVID-19 and this being the time of a pandemic has been the focus of everyone's concern. There's been fear and anxiety about going to a healthcare provider or going to a hospital or a clinic. We really need to get past that. We have to take care of ourselves and our loved ones. Please do not delay care or treatment for a chronic condition, an acute condition, an immunization, a well checkup. Our hospitals, clinics, healthcare providers are open and they are safe, and they are ready and willing to take care of you. Whether it's a medical, a mental health, or a dental health need, please do not delay seeking treatment from your healthcare provider at this time.
Thank you. Also with us is Sheriff Quattrone.
Thank you, Mr. Wendell. Again, I'd like to thank the community for all those who are complying in a voluntary manner. There are continue to be many people who are following the guidelines. However, there continues to be those who are either willfully not following them or due to the confusion of some of the regulations. As we start to lessen some of the restrictions, we need to continue to look at the forward.ny.gov to give us some guidance. Not be afraid to reach out if we have questions. Continue to stress the importance of wearing our face coverings when in public, when we are unable to maintain the 6-foot social distancing guidelines. It's not necessary when you're with family, you're in your cars, you do not need to have those face coverings on. And so we encourage, as we've been so often, is to have patience and respect for your fellow community members as you see them out and about. If they're not wearing them, understand that sometimes there may be a reason, but again, out of respect and hopefully to speed this process up, if we can get more voluntary compliance, that's our desire. Law enforcement across the county continue to consult with each other and work to hopefully, as we get complaints, to advise those who may be in violation of some of these orders, to advise them that there's a complaint, to educate them on that, and then to encourage the voluntary compliance. And the majority of our complaints, when we talk to those who we've received the complaints, are very cooperative and understanding, and are really truly doing what they can to continue to stress the importance of following the guidelines.
Thank you.
If I may add to that, Sheriff, one thing that you mentioned was riding in cars. And yes, when you're riding in a car with your family or those in your household, it's not necessary to wear a face covering. I would like to remind people, though, that the executive order is there for anyone who is operating a taxi or public transportation or any ride for hire. The driver does need to wear a face covering, and we do stress that because it's for the safety not only, of yourself, but out of respect for those who you are also transporting.
Thank you.
Thank you. All right, we'll now open it up for questions to the media. Again, our control room starts at 4 p.m., so I do have a hard stop for the Western New York control room meeting. So the initial questions will be limited to 3. If there's time, we will do more follow-up questions. So we'll start with Mr. O'Connor from Shawcat.
First question is for Christine. According to New York State Flu Tracker, in the recently completed flu season, Chautauqua County reported lab-confirmed 881 cases of influenza. Do you know how many deaths were associated with that?
Off the top of my head, I don't, but I can look that up and see if we have what reportable deaths we have related to influenza.
Do you know if there were any deaths?
I would be fairly confident in saying there had to be deaths from influenza. And usually it's the influenza complications, such as a pneumonia. So when you have someone who tests positive for flu, the complications are what become deadly of influenza, and typically that's a pneumonia.
Sheriff, in these unfortunate riots in Minnesota, I was listening to the governor on the way up here today, and he mentioned that one of the problems was they had, like every state in the union has, let a lot of people out of jail, and that these people were among those who were ringleaders in helping to destroy the Lake Street, predominantly African-American neighborhood of Minneapolis, and also in storming Precinct 3 of the Minneapolis PD. I wonder if in light of that, the state is going to, have you heard anything about revisiting the fact that, I don't know how many people were released from the county lockup, but a few I know. Has there been any word about they're going to take another look at that?
To my knowledge, we have not heard that they're looking at that anymore. They have not released any further since the beginning of this pandemic. Parole continues to look at releasing nonviolent offenders who are have perhaps violated without recommitting a crime. But at this time, I do not believe so.
PJ, you mentioned that some businesses, that it was good news about the cookie place up in Silver Creek, but you mentioned that you'd also received word that there are other businesses that, can you tell us what some of those businesses are that won't be reopening?
Yeah, the one we've received the most information on was Jamestown Metal Specialties. They reached out to us. We had a meeting with them in early February that they were going to reduce their workforce based on some decisions that were made that were not in the best interest and had brought some financial burden on the company. We met with them along with Crystal Sturdick from Jamestown, also met with members of the BPU, the IDA, reached out with some outreach, had a very productive meeting for a little over an hour, asking, what help we could assist them with, and they were going to look into that and get back to us. After that, we've heard in the last week that they're going to be closing operations in September. So, it has been outreach, and Mark Geis from the IDA is going to continue outreach. We knew there were some businesses on the bubble, if you would, so we're going to continue that outreach and, see if we can help them and assist them in any way moving forward. Okay. Dennis Phillips from the Post-Journal.
Yes, thanks, PJ. This question is for Christine. I'm just curious, on average, how long does it take to get test results back from the time a person is tested?
That would depend on the facility and the lab. UPMC Chautauqua does have a limited supply of tests that they are capable of running and getting a result in 45 minutes. Those are reserved mainly for people who are hospitalized or going for surgeries or in the emergency room or any other priority population. In general, most labs around here that tests are sent out to, I would say it's anywhere from 2 to 7 days.
Thank you, Christine. PJ, I'm wondering, for phase 2 reopening, what businesses are included in that, and are there any new metrics that are coming along with phase 2 reopening, or are they the same metrics used in phase 1?
The same metrics will be there from used in phase 1. We're monitoring those closely. We do have an epidemiologist from UB School of Medicine who one of the first couple of questions is asked of Lieutenant Governor. She always looks to Dr. Kane, our epidemiologist from UB, and we're monitoring those. He continues to tell us we trend in the right direction and monitors those statistics. They'll be the same. As far as the businesses go, I know several people are eager to hear that barbershops and beauty salons will be allowed to open, although we do remind everyone that owns those businesses that there is specific guidelines that must be met with that. Also, local retail businesses will be available to be open. And if we go to forward.ny.gov, they do elaborate and give more detail on each one of those businesses. But I do know the retail and hairstylists and salons are a big part of everyone's list. I want to remind people that nail salons, though, people are very specific to ask, and nail salons, even if they are part of a hair salon, are not allowed at this time. So again, hair salons, barbershops, and some pretty stringent requirements asked of those proprietors, but nail salons are not added.
Also, PJ, I'm wondering for phase 2, I'm kind of blanking on my question now. Sorry about that.
Okay.
Yeah, for phase 2 reopening, that's going to happen Tuesday. That's supposed to happen Tuesday, is that correct?
Well, there was some confusion that started today with the groups. As the information was rolled out to us, after 14 days, the data will be reviewed, and then we will wait until we hear the information as to when we will be allowed to go into phase 2. The belief is that would be Tuesday. We have to wait, and the governor makes that decision even after the metrics are reviewed, and we monitor them daily. That is still ultimately his decision. as was a little bit of the confusion that came out yesterday in a late press conference with several regions. But all 5 regions that opened in Phase 1 have opened in Phase 2, and we feel confident that our metrics are such that they will allow us to open in Phase 1, but the final decision is left to the governor.
Thank you, PJ.
All right, moving on. Mr. Dave Rowley from WDOE.
Well, good afternoon, everyone. Kind of following up on the discussion about entering Phase 2, is there a change in the way these metrics are being reviewed? The governor today explained during his press briefing that there are now global experts taking a look at the metrics, the data. Is that your understanding? Is this a new step, or has this been part of the process?
It's been part of the process all along. The doctor out of Rochester, not of Rochester, I think of Rochester, Minnesota. The doctor out of Minnesota is an epidemiologist. The gentleman, the doctor Dr. Bott out of London is a geostatistician, and they're the ones looking at those numbers as well. But, I feel confident we have a very accomplished medical professional that reviews our numbers. So, we review those every day. But, yes, that's a new part of the phase opening, and I think that caught a lot of people by surprise yesterday that those 2 individuals will now review the data as well. But, we do have our epidemiologist that we asked to be part of the control room, and he reviews those numbers, so we feel quite confident those numbers that we have in Western New York will uphold, and we should be getting to that Phase 2 opening early next week.
Now, do you believe that businesses in Chautauqua County are ready to enter Phase 2? Are you getting feedback from area businesses?
We have been getting a lot of questions and a lot of feedback from businesses. Yes, they're excited to open. They're asking where they get the guidance. Now, Phase 2 guidance didn't come out in its entirety until late last evening or early this morning. So we're asking businesses, if you're in Phase 2, to make sure you get on forward.ny.gov, get your template ready, get the safety plan ready, and be prepared. And likewise, anybody in Phase 3 and 4, we might be several weeks away, but planning is always a good idea, and making sure that we're ready to open. But I'm excited. I know the big box stores have had their chance in the game, so I think it's time right now to support our local businesses, those smaller businesses that have been run by families and individuals that have been, stifled and quiet for the last 2 months, to really get out there and support our local businesses. It's important. They're the baseline of our economy in Chautauqua County. They're the lifeline that we rely on, and they rely on consumers, and we need to support them as much as possible. So whenever you can, please, once we hit Phase 2, support local businesses that are run by our residents.
And I have a question for the sheriff. The governor announcing the other day this executive order that allows stores to not allow people into their businesses without masks. Will this change the way law enforcement enforces this executive order?
It was my understanding that the stores could always prohibit somebody coming in if they weren't wearing the mask. So it's really not going to change how we would enforce it. However, if the stores choose to enforce that and somebody continues to go in, we could charge an individual with trespass.
Okay, thank you.
Thanks, Dave. Moving on, Media One Group, Mr. Frank.
Yes, good afternoon, folks. Hey, I had a follow-up regarding the guidelines that have been coming out for Phase 2. One of the things that the governor talked about in particular for hair salons and barbers today was a requirement that they go through a test, that they have a COVID-19 test. Is this something that will be strictly enforced on the local scene? Is it something that the state is going to be handling? How is that going to work?
Well, Terry, that's a good question. That came out in his guidance. I know that I've had several concerns from local hair salons and barbershops, and it concerns me greatly because we are not requiring this type of testing from our frontline healthcare providers, our doctors, our nurses, firefighters, law enforcement. are workers that are in every other business that has been allowed to stay open this entire time. So why are we looking at, men and women who have been out of work for the last 2 months and requiring them to have a test every 14 days? It's a challenge, and it's something I'm going to bring up this afternoon. I just got off the phone with my counterparts along the southern tier, and we're all very concerned. That's the biggest pushback we have. Many of these people are sole proprietors, and to put that and strap them with a test every 14 days is very challenging. We did have a report, from one of our docs on my medical team that, somebody in the process of being tested was quite irritated and ended up, having some complications from the test. So having said that, it's a concern that we're, targeting one group of individuals that are licensed professionals when, there are so many other people working out there in close contact with COVID patients, and their requirement to be tested twice, every 14 days isn't required. That is a requirement for nursing homes, and their licenses for the nursing homes was in question if they weren't compliant. But I think it's unfair for some small proprietors, whether they're hairstylists or barbers, to have to be tested every 14 days. We don't know who the expense is going to be incurred by, but I know I'm going to bring that up this afternoon in my control room meeting.
And we're also not saying that we think everybody should be tested. We don't want the next requirement to come down to say, okay, then everybody will have to do this in this country. So,
Yeah, for sure. I would think that if a hair salon or a barbershop wanted to be open next Tuesday, if we do get the go-ahead on that day, they would have to think about getting a test almost immediately, wouldn't they?
Well, there's still some, there isn't a lot of clarity to that. Those are questions that we'll ask, and I'm sure that will be coming out in the next couple of days. We haven't seen any specific guidance yet, but that'll be a topic of discussion in our control room, I'm sure, this afternoon.
All right. Thank you, folks.
You got it. All right. Western New York News Now. Justin.
So to kind of follow up on Media One's question, Christine, in regards to administering COVID-19 tests, does it have to be a healthcare professional necessarily, or is that something that usually there would be? Because if the governor did say, we're going to go forward and have businesses test people coming in the door, you'd think that you'd want a doctor or a nurse.
right. Yeah, that technology doesn't exist that I'm aware of at this time for someone to do self-testing. There have been some tests that have been, I think, more experimental. They aren't haven't been validated. The take-home tests are not recommended at all if you see those advertised. Right now, the recommendation is a nasopharyngeal swab. So it's a long, flexible plastic swab with a little cotton on the end that's inserted into the nares, and then a sample is taken. There are some other alternatives where you can use an oral pharyngeal swab, which is similar to what you might get if you have a strep throat test done, so test the back like your tonsils, along with a swab that just tests the anterior part of your nose. So those are some of the options. Also an option that some people are now using is a swab that just does the anterior nose, which obviously is much more comfortable, but the sensitivity of anything other than a nasopharyngeal swab is much lower. So you have a much higher chance of getting a false negative than using the nasopharyngeal swab, at least with the technology that we have currently.
And then a follow-up to your comments in regards to healthcare in general. We actually had a few viewers reach out to us this week who were beginning to go back to their doctor's offices for checkups, and they have various protocols, make sure you have a mask, they call you in before you come in. But one of them in particular was really concerned because there was a gentleman who came in to the waiting room and didn't follow any of the rules, and he was there to pay a bill by the looks of it, but he didn't have a mask on, he didn't wait to come up to the window, he just walked up and said, I'm here to pay a bill, da, 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 da. For that type of situation, are these physicians able to implement stricter guidelines, or how do they protect that? Because the resident we talked to was very concerned about this person not following any of the rules.
Well, I hope that person talked with whoever was in the practice that they were in, whether the healthcare provider or whoever runs that. Many of our practices are private businesses, so they have the same rights and responsibilities as everyone else. I guess many of us think that healthcare providers should be held to a higher standard because there are quite often people who are ill or who are immunocompromised or have chronic health conditions. Everyone that I know of is very conscientious of that and will do all that they can to maintain proper protocols within their practices. And I would encourage someone to have that discussion with their provider if that happens, in a practice that they go to. But we have an ample supply of hand sanitizer, of face coverings, of surgical masks, gloves right now in the county. And I know our Office of Emergency Services has been taking orders from private healthcare providers so they can start to see more patients within their offices now instead of just having to do a lot of the telehealth, which has been good, and that's still going to continue, I hope. But people can start coming into the office for those who really do need to be seen, kids that really need to stay on their immunization schedules, preventive screenings that really need to be done. So I know that there have been a lot of shipments being delivered to our local healthcare providers as far as personal protective equipment, signage. Healthcare providers in general, I think, are being very cautious. But it's no different than you're going to the store. There's going to be somebody that walks in that's not going to have a mask on, that's not going to abide by social distancing. But that's why it's so important that each one of us are responsible for ourselves and for our own behavior, and we do the best we can to protect ourselves and those that we love. And you'll notice there's always a common theme here in everything we're talking about. And it goes back, to that. Wash your hands frequently. Don't touch your face with dirty hands. Use hand sanitizer if you don't have soap and water. Sanitize surfaces frequently. And if you can't stay 6 foot away from somebody, wear a face covering. I mean, those are common themes. It doesn't matter if you're a business trying to reopen, if you're a healthcare provider or a county government employee. These are all the same. Granted, that's the foundation of everything we're doing to try to help prevent the spread of an infectious disease. And then whatever the governor does above and beyond that is what it is.
And then I had a question for County Executive Wendell or even Sheriff Quattrone, whoever sees fit to answer it. We had people reach out to us who were concerned over the weekend where they saw another large gathering of what they assumed was possibly an Amish wedding. How is the communication with that community, and is there anything that can be done to try to educate them more and have them follow those guidelines? Because the person saw them walking right down the road in Asheville, and they're like, what is going on?
I've spent a considerable amount of time communicating with the Amish communities and have had some great cooperation. As far as educating, they are well educated on this pandemic, and they are starting to share amongst each other the social distancing, the guidelines, and have been very respectful. And they are trying to abide by it as much as possible. I know for my worship services, I'm able to use the internet and to continue to have the worship. And truly, the worship hasn't stopped, and it shouldn't stop just because we have a pandemic, but we have other ways to do that. The Amish community doesn't always have that access, but they are doing what they can to prevent it and continue to work alongside of us and have been very open with us.
Yeah, I think what's interesting with that is we have a great deal of outreach. I know the sheriff has been there personally, John Griffith of Emergency Services, we have Mark Stowe from Environmental Health also. So the outreach we've had from a county standpoint has been, tremendous. But, it's not just one individual group we're looking at. We want to make sure we're, keeping everybody in mind. But the outreach has been extensive, and I really applaud the efforts of everyone that's been, going above and beyond to make sure that they're educated. And the sheriff said, they're doing their best to, become educated on this and, do the right thing.
Thank you.
Questions? If not, we'd just like to remind everybody to continue the hard work. We're moving closer to phase 2. We're hoping that we get there by Tuesday or Wednesday. Again, remember, stay home, stay healthy, stay safe, and we will continue to be CHQ strong. Thank you.